Well, one of the most common heel pain conditions I see is plantar fasciitis. Achilles tendonitis is a close second. The Achilles tendon is the largest tendon in the body. While it can handle forces of 1,000 pounds or more, it's not infallible. When it becomes inflamed, it can sideline even the most seasoned athlete. And while runners and other outdoor enthusiasts are more prone to developing it, non-athletes can also acquire it. That's because the Achilles tendon plays a large role in helping us run and walk. Today, I'll be talking about what causes Achilles tendonitis, its symptoms, treatments, and how to prevent it from recurring. But before I do, I'd like to introduce myself. I'm Dr. Rion Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written an ebook to help you learn more about one of the primary causes of morning foot pain called Stop Living with Stubborn Heel Pain. You can find a link to download it in the description below. If you find this information helpful, please remember to like, hit the subscribe button, and then hit the bell so you can receive notification every time I release a new video. As I mentioned, while Achilles tendonitis can affect anyone, runners and other athletes are at greater risk for developing it due to the repetitive stress put on the tendon. Here are some specific factors that also increase the likelihood of acquiring it. Running uphill or climbing stairs. Increasing your distance or speed too quickly while walking, running, or playing your favorite sport. Starting exercise too soon after a period of inactivity without proper foot and ankle stretching and warm-up. Wearing inappropriate footwear, including worn-out shoes. Having an abnormal foot structure such as flat feet with a tendency to overpronate. Tight calf muscles. Being older. Having certain medical conditions like psoriasis and high blood pressure. Taking certain drugs called fluoroquinolones such as Cipro or Levaquin used to treat infections. So what symptoms will you experience with this condition? Achilles tendonitis often begins with mild pain in the back of the heel or just above it, or in the leg after exercise that gradually worsens over time. Other symptoms include pain, stiffness, and tenderness in the back of the heel first thing in the morning and after rest. Symptoms will usually decrease with movement. Pain in the back of the heel when you wear shoes. Swelling along the back of your heel. Tenderness or sometimes intense pain can be experienced when the side of the tendon is squeezed. Next, I'll talk about how Achilles tendonitis is treated. First, you'll need to stop your current exercise. I know you probably don't want to, but if you're going to heal, this is very important. Athletes who continue to play on an injured Achilles tendon risk an Achilles tendon rupture. You may be able to immediately reduce stress on the Achilles tendon and pain by adding a 1/4 inch heel lift to your shoe. Apply it to both shoes under the insole if possible in the back of the shoe. Next is icing. Icing not only helps reduce the pain but also the inflammation which drives the pain. You can fill a Dixie cup with water, freeze it, and then tear down the sides. Ice for up to 20 minutes several times a day. Anti-inflammatory medications can be helpful in reducing pain and inflammation as long as your doctor recommends it. Other abnormal foot mechanics, such as flat feet, play a significant role in the development of Achilles tendonitis. To properly align a flat or pronated foot in moderate to severe cases, we use custom orthotics. If you have a milder case, you can try over-the-counter inserts first, such as Power Step or Ready orthotics. Stretching is critical for those with tight calf muscles. To get the proper stretch, I advise my patients to use an Achilles splint during the day for 30 minutes a day. I'll put a link above to a video about how to do this. Because morning pain is often a problem due to tight calf muscles, it's also a good idea to properly stretch before getting out of bed. Again, view the video with the link above. In severe cases of Achilles tendonitis, immobilization with a walking boot may be required. Physical therapy can also help and strengthen areas around the Achilles, obtaining gait and running training, and use of ultrasound for decreasing inflammation and promoting healing. Another great tool for healing is a new MLS laser therapy. We apply this new therapy right in our office. This laser reduces pain and inflammation and helps heal at a cellular level. Fortunately, there are a lot of steps you can take to prevent yourself from developing this condition in the first place. And many of those steps can also prevent a recurrence. If you had Achilles tendonitis before, It's critical to follow through on all the treatment recommendations to avoid a degenerative condition called Achilles Tendonitis. Other things to consider for prevention are purchasing the right footwear is essential in preventing recurrence of Achilles tendonitis. If you're a runner, check out my video, How to Buy Shoes to Prevent Heel Pain, in the link above. If you engage in another sport, it's important to purchase footwear made for that sport only. For example, buy court shoes for playing tennis or pickleball, cleats for playing soccer, basketball shoes for basketball, and so on. Next, you'll need to gradually increase your training time. Your Achilles tendon can't adapt quickly to a big increase in training. Take some days off in between runs or whatever sport you engage in, and don't increase the amount you work out by more than 10% a week to avoid injury. Changing up the type of exercise is also beneficial. Try yoga, biking, or swimming to give your Achilles tendon a rest before returning to hiking or running. It's also very important to vary the terrain you run on from day to day. In Seattle, you have lots of opportunity to get a great workout on hills. But don't overdo it, or your increase on your Achilles tendon will place it at risk for further injury. For example, if you work out on hills one day, consider taking a day off in between your running and then running around Green Lake, flat surface, the next day. Always warm up before working out. Dynamic warm-ups for runners are very effective. I'll put a link above so you can learn how to do this properly. After working out, static stretches are important. I'll put another link in the description. If you've tried over-the-counter inserts and they aren't working for you, you probably need custom orthotics. While over-the-counter inserts may give you some arch support, they won't provide the alignment you may need to prevent Achilles tendonitis from coming back. Also, custom orthotics will last up to 3 years depending on how much exercise you do, whereas non-custom arch supports will only last about 6 months. To learn more about Achilles tendonitis in runners, see the link I've put in the description. If you're a hiker, I've created a video on that topic, which you can check out in the link above. If you like this video, please remember to like and hit the subscribe button. In conclusion, I hope you now have a better understanding of what you can expect at your podiatrist's office if you develop Achilles tendonitis. But more importantly, now you have the tools you can use to prevent it from developing in the first place.